that's it. Everyone's always like, well, I'm not sure on this, and I'm like, trust me, you'll be sweet. Let me do the heavy lifting. That's all part of the fun. All right, welcome back to another episode. Deafening you at the start of the episode there. I got a bit of reverb. Sorry, mate. Hello! And we're awake. Everyone in the car's like, thank you very much. So as you've ascertained, we're back with another episode. We're back with another talented guest, as ever, your host, Alex Connor, and I'm joined today with Matthew Davidson. How are we, my friend?
I'm good. I'm very good.
Yeah. Thanks for coming all the way up.
We've been trying to get this together for a while, and I'm finally here.
Mate, sometimes, as the maxim goes, better late than never.
That's right.
You know? Right. And this is going to be a goodie, mate, so I appreciate you coming down.
I'm happy to be here. I've been looking forward to it, just finding the time.
It is, it is. And it's like that these days, isn't it? With everything and when you're
family,
in demand
business, you know, I've got 2 young kids. It's just full on. You know, I need more hours in the day.
Yeah.
It's crazy.
And I think I don't have enough time. I'm going to get a rude awakening when I have a family, aren't I?
Yeah, you are.
Then I'm going to be like, oh, now I really have no time. Now I know exactly what everyone was telling me.
No time, no money.
Yeah, well, you're doing well, Alex. Yeah, the kids and the wife are doing well. No. But it's a bit like that, but you invest. You want to set yourself up.
Exactly right.
Now, tell the people, for those that might not be aware, first of all, who you are, what you do, but more importantly, why you do it, please.
Okay, I'm Matthew Davidson. Been a chiropractor for 20 years. Have 9 years university behind me. I basically got into it because I got introduced to a chiropractor when I was in high school, and I always wanted to do something, you know, physical therapy, personal trainer, exercise. Well, there's no exercise physiology when I was coming through, but something like that, physiotherapist. And then when I met this guy, it was just amazing what I could see what he was doing, the whole philosophy behind chiropractic, the nervous system and how it functions and how it relates to everything in the body. And I thought, this is what I want to do. And he was very successful at what he did as well. So I just knuckled down at school and just went straight from high school into university. Did 3 years at Griffith University doing a science degree. I needed to do a bridging course to get into Macquarie University, but I stayed and finished that first science degree. Then I went to University of Queensland, did another 3 years of anatomy and physiology. Then I went to Sydney, did 3 years down there. So the first year was like a bridging year for the Masters of Chiropractic. I did a whole year of pathophysiology at University of New South Wales, and then 2 years Masters, and it was full on. And I was just massively committed once I got down there. Like, it was just full steam ahead. This is what I want to do. And you know, a lot of people when they go through uni, they do their course, and you know, I've got to study this to get through this exam. I just come to the conclusion, you need to know this for the rest of your life. There's no point to studying this to get through this exam, the next exam. You need to know this for the rest of your life. So that was a big thing. So I was mad. I just would study till 10 o'clock at night every night. I had no social life. I did security at the university, which was an excellent gig. I bought every single textbook that was not on the curriculum at university. I had this massive library. I was just so committed to be the best at what I did, so it was great. And I came out and here I am, and I do it because I just love helping people. There's nothing better than having someone come in your door that can't walk, or they've had something for so many years and no one's been able to help them, and you get them right. There's no better satisfaction than that.
Yeah, I can concur, my friend. You can't put a price on that.
No, you can't.
And for a lot of people, it is life-changing.
Oh, it's massive. Me changing someone's life is to me is awesome. You know, so, and you know, I'm busy. I've been doing it 20 years. I'll get people come from everywhere. They'll drive from Sunshine Coast to come and see me. I had a guy years ago come from Russia.
Jesus, there you go.
Yeah, and another guy would come from New Zealand because there wasn't many active release technique practitioners in New Zealand at the time. He would fly over, stay down the road at Runaway Bay at a hotel, and come to me every single day for a week, and then fly back. He did that for several years. I thought he was mad, but I was happy to help him.
That's what you do, though, when there's good people. We recently were talking about the back mechanic, Dr. Stu McGill.
Yeah.
Same sort of thing.
Yeah.
And people, you know, and we'll get onto this because there's a lot of misconceptions in your space. In our space, there's a lot of practitioners. It's like, I guess it's in every realm, right? I always say there's a black belt and there's a black belt, meaning, you know, just because someone's got a black belt doesn't mean they're competent.
Totally.
And you've got to maintain that skill, that efficacy, etc. And it's the same with this. And you made a really valid point before. You said, I might as well know this now, because it's not as if I'm just going to go, well, I get my test, I pass it, and then see you later. No, if you're going to help people, especially when we're looking in the realms of, we're putting hands on people, we're going to be applying pressure to physiology. You can't get that wrong. It's like a surgeon taking shortcuts. It does not work.
You can't take shortcuts. And look, mate, you don't know what's going to walk in the door. I've had people come into me and they've got some weird stuff going on, and I'm just like, straight away, you know, the warning bells are going, and I'm thinking, this is not good. You know, send them away for a test, and they've got, you know, they've got lung cancer.
Oh,
and it's through their spine, or they've got multiple myeloma. You know, I'm sending off to their doctor, going, you know, I think he's got this, and you know, the majority of doctors are good these days, but back 15 years ago,
well, you've seen it evolve, haven't you?
they're like, what's he going to know? He's a chiropractor, which was really bad, because I'm like, it's not about you and me, mate. It's
we're
about
on the
this.
same
It's
side
about this
here.
person here.
Yeah.
That I think's got a serious problem. We need to do something about it. So it's funny. Of a lot of the doctors in my area there at Hope Island now, they know. They've been there long enough, and I think having their patients come and see them, that come and see me, and they talk to the doctor, they're now sending me referrals all the time now, you know, and I'm happy to give them an update report as well. And I think that's important, keeping that contact there. You're just like, thanks for the patient. No communication back. I'll tell them, this is what I think the person's got, this is what they need to have, and then I keep them updated. Yeah. And I think they appreciate that. And look, it takes a little bit of time out of you, but the reward is massive, you know. And I've got another doctor that he's shifted around the Gold Coast a fair bit, but now he's at Robina and he's got his own practice, and I send people there for PRP. When I've got a soft tissue injury coming in here, and I know there's a partial tear here, go and get some of this, go and get the PRP, because you know, and look, it's funny, a lot of people out there going, I'll try that. It all depends, again, on the black belt of the practitioner, you know. And honestly, I can safely say I've had a 99% success rate with anyone I've sent to this guy. They've all come back.
Dr. Ken, right?
Yeah, Dr. Ken Cameron here at Robina. And it's amazing. And I've had heaps myself. Yeah. I've probably had more PRP in his office than anyone he's ever seen. And it's all worked.
Well, yeah, it's helped the clients that, you know, sort of referred onto you, that I've trained, that have gone to him, and they've, you know, and they're very apprehensive initially, which understandable.
There's people doing it out there, and they're not doing it properly. They either don't have a proper centrifuge.
It's the problem.
Or they're not doing it under an ultrasound. And you know, Dr. Cameron is so passionate about what he does. Yeah. And he's so careful about what he does that I've got 100% faith in him. And he keeps telling me to stop telling people that you know, he's got a 99% success rate, because he's humble enough to say, well, you know, sometimes I'm not going to get it right, but so far he has. Yeah. And he knows when not to either. He knows when there's something else going on, and he and myself will refer to other practitioners when we find that this is outside the realm of that sort of modality. So.
And that's why we're all, you know, specialists for a reason, right?
Well,
because you can't specialise in everything
if
you're going to be really good, because there comes a point where you don't have enough time, knowledge, hours on the earth. Like, if you're going to be really good at something, you've got to really go, you know, an inch wide and a mile deep.
You've got to, and you've got to know too, as a practitioner, who the good people are to send these people as well.
Yeah, you've got to build your army.
You know, there's some people out there that are specialists and they're not that good.
No, that's the problem. People have the horror stories, and or they have a bad experience. I know. And especially in your industry, it's a really big one, and we'll get into that with the misconceptions and why people get through it.
I'll be happy to get through that.
Oh yeah. And people just go, oh no, well I had this happened, and they don't do it. It's like, well, because you've seen one or two.
Exactly.
Unfortunately, it's like you might have to step back and go, maybe I did have a bad experience, maybe I didn't get the best referral. But I shouldn't. It's like, I always use a basic example. You got bit by a dog when you're a kid, all dogs are evil. Well, no, they're not. Like, that dog was vicious. You might have got unlucky. But people can relate to that, right? Because everyone knows dogs.
But it's amazing how many people I see come into me and they've never been to a chiro, and even like their doctor has, the doctors I know have said, you need to go and see Matt. And they go, oh God, he's a chiropractor. Really? Yeah, you need to go. And they come in, and it's quite funny actually, because if the husband's been referred, if the wife's been referred, she'll send the husband in as the guinea pig, and I see it coming, and she'll come in and watch, and I'll do my thing, and then she'll go out the front, and then she'll make the appointment for herself. And I'm like, I don't know what you think was going to happen when you came in here.
Black magic, mate.
You know, I'll wave a crystal over your head or something. But it's amazing, and it's amazing too how many people have had a bad experience, and then they've come in, they've gone, oh look, I'm a bit apprehensive, and I said, don't be. Don't be.
That's a better way to do it, though, isn't it? I think if you were up front and say, look, I'm a bit nervous because, and you go, well, understandable and rightly so.
Well, this is the thing, and I've got so many modalities I can use. I'm thinking, oh look, I don't really want my neck cracked. I said, I don't need to do that adjustment on your neck.
Well, that's what people think. You're just going to snap bones.
Well, and unfortunately, unfortunately what happens in my
it's just crack bones
in my profession. Like they're in the door, they're in and out in 2 minutes. I mean, I don't even know what the person's doing in 2 minutes. I mean, I spend 5 minutes talking to the patient, then I examine them, and I treat them, which is what you should be doing.
Well, you seek to understand.
Exactly.
And like you don't just go, oh, well, the car's got a fucking this, we'll just try this. It's like, no, you've got to ask questions and diagnose it first.
That's right. And that's when people miss stuff. That's when people miss important stuff.
Important stuff is the key word there.
You know,
and then they get damaged because they're treating the wrong thing.
Exactly, or they've got something really bad, pathology-wise, and you're not picking it up, but you're whacking away at them each week. And and I'm not afraid if I don't see a change. I'm pretty hard on myself. If I don't see a change within 1 or 2 visits, which is really putting pressure on myself. Something's wrong, or I'm looking in the wrong direction.
Yep.
And we need to change something up. I'm not just going to keep coming you back. I'm not one of those practitioners, and you see them out there. I need to see you 6 times, 3 or 4 times a week for the next 6 weeks. What is that?
That is people robbing people of money.
That is the biggest problem in my profession.
Yeah.
Like, I don't know where you pull that magic number from. Like, I want to get you better.
Yeah.
And no offence, I want to move you on. And if you want to come and see me maintenance-wise, which I'm happy to do, and I've got a lot of people that see me monthly, that's the ultimate goal.
Yeah.
I just want to get them back functioning properly again and doing what they enjoy doing.
Exactly. You shouldn't, if you're good at what you do in this particular scenario or in your realm, you shouldn't have to, you don't want to see people. The goal is to not see people, well, the same people repeatedly, because you want to actually be fixing them. Because if you have to see someone all the time, you're either robbing them blind or you're being disingenuous and you're not actually helping the person. And people, oh, where the customers come from? Well, they refer other customers, and people are always fucking getting injured because humans, we're just useless, aren't we?
Exactly.
Really. Before we continue though, I want to sort of define a couple of these roles, which I often do when I have these conversations for people listening. So for example, because people get confused, and again, it depends on where you're listening in the world, because I know we've got some listeners elsewhere, overseas, and it is a little bit sometimes different, but you can clarify.
Yeah.
We've got osteopath, right? We've got physio, we've got chiro, there's many more. I find most people confuse those three. That is my experience. I don't know what yours is, but I'd love to maybe for you to define the differences. Also, I'll grab your coffee for you. Carry on.
No, I'm finished.
I'm
finished.
Did you knock it out? Was that it?
I knocked it out.
Did you?
10 out of 10, the front desk.
Was that all right? All right, she can keep a job then. You've done well if you're listening.
Yeah, she can keep a job. So, traditionally, a chiropractor would be someone that relates spinal conditions with what's happening with the nervous system and everything.
Correct.
So everything is related to the spine.
Right.
So they're firm believers in that the nervous system is the key to everything, traditionally. Okay? Osteopathic, the blood flow to the muscles and everything, the blood flow is the key. Pretty much doing the same thing, but different philosophies.
Yeah.
Now, physiotherapy, it's more of a rehab, traditionally rehab, a little bit of soft tissue. You do have your manipulative physios, chiropractors probably do the most manipulation in the world, followed by osteopaths, followed by physios, so down the line like that. And they're more of a rehab type thing, really. Soft tissue, stretching, exercises to help the injuries or whatever, and then you've got them in the hospital roles helping with people with post-surgical stuff and stuff like that. Which is what. Me, I'm a bit of everything. I'm all that.
Good. I'm just going to jump in because
Which makes me different.
Yeah, that was my interpretation.
Yeah.
Because, I mean, cast your mind back years now when I first came to see you.
Yeah.
I just did something to me back. I was doing incline bench, of all things, and it was like someone shoved a dagger right side, thoracic spine.
Yeah.
And I remember I couldn't even sleep. I was in that much pain. I rang the gym at the time as World Gym, and I said, look, I don't, because I was new to us. So I said, do you know anyone? They referred you on, right? Because I think you'd worked with John.
Oh yeah, John David referred you on. Yeah,
correct.
Yeah,
that was kind of where it came from.
I still remember what you had when you came in. Till you had a rib had slipped in the back of your spine.
Exactly, and I had no fucking clue, especially at this point. And you know, we came in and you did that, and I was trying to segregate, like, okay, well, you know, I'm learning, what do you do? And then over time it was like, oh, when people ask me, I said, well, because people go, oh, he's just a kind. I was like, actually he's not. And I've always stood there and go, he's kind of an amalgamation, like he kind of does a bit of everything.
Yeah.
And I just refer to you as the magician. So, and I'm just like, and then people are like, what do you mean? I'm like, this is the man that I go to when it's, he's the last defense. I'm like,
last resort, you got to see Matt.
Yeah, so ultimately you become the guy who I send most people to, because most people don't want to fuck around. So.
No, I'm not one of those ones that wants to do that.
Unless it's something specifically else with a practitioner like you. I've built up an army of health professionals.
Exactly.
But I tell you what, it does wonders, because you can actually then go, right, people trust you more, and you've got these army and you bounce each other.
You know,
it works.
I think that's what changes people when they've been to a chiropractor that is just traditional chiropractic and just manipulates or adjusts the spine and does nothing else.
Yeah.
And doesn't do anything outside the spine. So
Correct.
you know, they can't even really treat an elbow.
Well, that's it.
And that's just their choice. That's totally their choice. But when I came out of Macquarie University, that university was actually earlier an osteopathic and chiropractic school combined.
I see.
And in the 80s, if you came out with and graduated, you had both. You were both an osteopath and a chiropractor.
Which kind of makes sense, because what you were saying before about they're similar just from different angles.
Yeah.
Although we want to be specialists, you do need to have what I call a fringe sort of understanding of your fellow practitioners. Yeah. So and the reason why I say that is because, say if I'm going to go, oh yeah, I'm in my head, someone says, Alex, I've got this, this and this, and I go, well, cool. Ask the questions, again, assess, diagnose, and then as I'm doing that, I'm problem solving and going, Matt, Nathan, Tim, like who's the right person depending on the, right?
Yeah, exactly.
But if you don't know, if I don't know what you do, and I always say, right, I've always worked with all of the people I've worked with them personally, unless it's something like an oncologist. I've not had cancer, so you know, I can't experience that, and you know, hopefully don't want to, but you sort of, you understand what that practitioner, you've experienced it, and then you can go, right, well actually I think this is the best pairing, and then obviously then it's up to you to decide.
Exactly.
It's a better experience ultimately, like you said, for the person we're trying to help.
Yeah.
As we can go, we're not fucking them around.
No, exactly.
But I put it in, sorry mate.
No, that's okay, but I mean, so with what I do, I'm very osteopathic. A little bit of physiotherapy thrown in there, because I rehab exercises, TheraBand exercises, kinesio taping, sports taping, whatever. But chiropractic has diversified over the last 10, 15 years, where you do have these specialist sports chiropractors that do all that as well. So, and that is really the problem with my profession. There's so many little nooks and crannies that people do. You've got your wellness-based people that, you know, they'll bash people's spine until they think they're doing the right thing, which I don't agree with.
No.
And then there's people like me, and then there's other people that are sort of a bit of both. And that's great, whatever, but I mean, I don't want to see someone 3 times a week for 6 weeks if they're not getting any better. I mean, I'm going to be wondering what the hell I'm doing wrong, And why do I need to be treating that person so much? I really try to get them active involvement in their treatment, so I give them exercises as soon as I can. And this is the problem I see with a lot of people that do see me for soft tissue injuries. I'll come in and say, I've been to the physio, I've been going for 6 months and I'm no better. And I'm like, what's wrong? Oh, I've got a tennis elbow. Oh, what's the physio done? Oh, he's given me these dumbbell exercises to do. And I'm like, okay, you're not ready for that. That's why it's not getting any better. You're just inflaming it constantly. And a lot of them these days, and there's a lot of good sports physios around, and they're getting few and far between because of the old school guys. And unfortunately, what's coming through the ranks now through the universities is that they seem to be doing less hands-on stuff and just go home and do these exercises.
Yeah,
which I've had a conversation with a couple of old school physios, and they're concerned. They're concerned with that.
This is interesting. Again, reading Stuart's book at the minute, it seems so simple, right? Because now they're almost not listening to the patient, like you said. They're not assessing, and all they're doing is just quickly going, this exercise, this drug, this, but oh, hang on a minute.
Yeah.
You've sort of missed what's in front of you.
Yeah.
And you're treating the person like an exam or something, like a test, and you're just trying to match that person up with, this is what we've been told to do, but you're actually missing the whole point. So what is going on in the educational system, and why is now the standard lower, or why are they missing? Is it because of the technology now, do you think? I don't know.
I'm not sure. Honestly, I'm not sure. What I do find in my profession, when people do come out, it also depends on the university. You know, there's a couple of other, which I'm not going to mention, but there's a couple of other universities that have popped up in the last couple of years that have started the chiro course, and you know, and the students have come to me and they're observing me, and I'm asking questions. Oh, you've been shown this? And no, not really. It's kind of scary when I see that these universities, even though they're only young, they're not fully educating these guys as to the capacity that I came through with Macquarie University. We got slammed.
I think a good example
is
30
hours a week of spinal manipulation practice.
Yeah, well, they've taken that a lot of that out now, isn't it?
Well, I don't know about Macquarie, but all these other universities, they don't seem to have all that.
They're missing the practical element. It's all theory and like not enough actual hands-on work, which is how you learn.
Well, you know, there were years ago there in the 90s that Macquarie was known worldwide. If you came out of Macquarie, you were really good at manipulating and adjusting a spine.
Yeah, it has a reputation like Harvard or Stanford based on certain
And don't get me wrong, you know, we all came out like loose as gooses because we got pushed and shoved in every direction. And this is the other thing with the safety aspect. Everyone's going, oh, it's unsafe. We were students. There was 90 of us, 30 hours a week, sorry. No one got injured.
Funny that.
You know, it was very well run. We had excellent tutors, you know, that guys that had been in the profession that would come and give up their time to come into the university and teach us full on. And I have to say, my year was the last year that actually had the best of the best teachings, because after that the university got a little bit political and said, well, we don't really want these people just coming in, these contractors, that we want full-time staff. And who's going to give up private practice earning this much money to come into the university and not earn that much money? I mean, so
yeah, there's a bit of a disconnect.
It was a bit of a shame because a lot of the people coming through Macquarie now wouldn't have got the attention that we got, which was fantastic. You know, really, we came out great practitioners.
I do resonate with that though in one respect, because I was fortunate in New Zealand, I think, where it was 50% theory, 50% practical, and New Zealand is a very small population, as people know. There's a lot of niches. You got your upper class, lower class, there's not much in between, but we were in the world class facility and we were training with all like the elite athletes. Yeah. And we had all like the oxygen chambers, and because the numbers are smaller, you get all the attention. Yeah. And the people who do really well become the tutors. So we, like you, I the amount of people, and I use the example of like the Cert 3 and 4 now, it's a joke, almost like 12 weeks and you're a PT. I'm like, yeah, right, okay. Where's the bridge gap? Like, you know, because what makes a good trainer is the years of experience. And don't get me wrong, no one ever comes out knowing everything, and we're always learning.
I'm still learning stuff.
Well, that's it.
You never stop learning.
You never. Well, if you think you do, you know nothing, right? I think this should be. I mean, I did a degree, and even I think that's like minimum. Do you know what I mean?
Yeah.
To a degree, but we were doing dissecting lungs, and you might say, what's that got to do with it? It's like, yeah, but it gives you perspective, because they were giving you with this well-rounded base of physiology. We did coaching, we did psychology. Again, we had coaches who coached like the elite athletes who had been in the industry for 20 years. You can't buy that. I look back now and value it more, because when I was young, I was 17, 18, I probably wasn't in a position where I was ready, but I wasn't ready to where I am now. Yeah. I'd go back now and I'd absolutely lap it up. Like, I'd go, oh, this is just next level. And the toys we got to play with. Yeah. Because it was all there for us, like you said, and we had people coming in who were the real deal, and you got to just speak to these people and get experience from them. And now, as you said, they just seem to be kind of skipping, whether it's from the financial perspective or, you know, they're trying to make these shortcuts, but it's almost like we're always trying to fast forward things. But you can
doesn't
only
work.
No, because you can only. It's like a tomato takes amount of time a tomato has to grow. You speed it up with drugs or whatever they use in the ground, you get a different result. It's still not quite the traditional. There's a reason why certain things take a certain amount of time. Totally. But we
and getting back to your point there before about, you know, taking the time I take a full history. And this is where it separates you from other practitioners.
Yes.
I know for a fact that, you know, some officers, you turn up, you fill in this form, you hand it in, the guy quickly goes over it and he gets stuck into it. I ask them everything. What hurts? What makes it better? What aggravates it? When did it start? Get a clear perspective of what's going on before you can start to examine the person.
You're building a picture, aren't you?
You've got to know everything.
Yeah.
And then I put them through a rigorous examination and work out what's hurting and what's not hurting. So I know what tissue's being inflamed. Now that also brings me to the biggest point. If you don't know your anatomy, you're going to be useless.
Well, it's true, isn't it?
You've got to know what tissue's being stretched. You've got to know what's being compressed. You've got to know what nerve's being pulled or crushed. You've got to know that stuff. And I'm actually, it's quite alarming when people do come to me and they've said they've been going to this person for so long, they're not even looking in the right spot.
They're just miles away.
It just amazes me. And then I treat the person and they're almost better after one treatment. And they're scratching their head going, I've been seeing this other person for 6 months. Look, I don't.
No, you don't.
I don't badmouth, but I'm almost like, you know. Well,
actions speak louder than words.
It's just one of those things. It's amazing.
It's like they're going in blindfolded, man. And like by asking the questions, you're lighting up the proverbial metaphorical cave. You'll never get the full light on, but you're basically honing in by asking the questions, and then obviously you've got all this information. You're giving yourself the best chance, and I think this is the key to get to I always say this to people, you get to the root cause, the actual problem. Yeah. And as I've learned, as you know all too well, where it hurts isn't always the root cause.
No, totally
Which has
not.
been one of the biggest learnings for me. I'm like, oh shit. I mean, like it was with the cervical bit. I'm like, my shoulder, and you're like, mate, your shoulder's bulletproof. And sure enough, it's the referral pain from the cervical part of the spine. And I'm like, oh wow. But you don't. I mean, again, that's not my area. But like, if you don't know that, it's like shit, man. Like you could be like you said, you're treating a muscle.
But this is the thing. This is the thing. You got to, thorough examination of the shoulder.
Yeah.
And you'll nearly push me through the roof. And I'm like, it's not your shoulder.
I could be screaming.
Because you wouldn't have any strength there, or it'd be lower, less, and there'd be pain there.
Yeah.
And it was coming from your neck.
Fucking unbelievable, eh?
It is.
And it's hard to discern as someone, and I guess as a patient, if you don't understand that. Yeah. I mean, you do, right? You go pain here, pain there, that's the problem.
Yeah.
But that's not how the body works.
And sometimes it is, though.
But sometimes
the pain is just there.
Yeah, exactly. Well, that's it. And then that's when you've got to overcomplicate it,
That's right, yeah.
Yeah, which is a really big one. Apart from some of the things we've mentioned, what I want to run through now is the biggest misconceptions about people in your industry. I guess when people come to you, and it might be, again, the snapping necks, cracking bones, all of this, what they think you're going to do versus what you actually do, or even just other misconceptions that you hear about your profession that is untrue, especially for people listening, to kind of set the record straight?
Well, this is a big question, because there is this small group of chiropractors out there that still believe that everything in your neck and spine is causing your problem. Everything. Which is unscientific.
It's like saying the Earth's flat, sort of thing.
Well, yeah, and it's unscientific.
Yeah.
Someone handed me this form that they got from their chiropractor about 6 months ago, and it's got if this level of your spine's out, this you're going to have this wrong with you. You're going to have ADHD. You're going to have this, and I'm looking at
one of those things,
and I'm like, oh my god!
It's like a reflexologist.
I mean, are you serious? Like, that's just not even proven. You can't go peddling stuff like that on people.
Yeah, because that sort of, people can then go out and do things that are not right.
Well, and these are the ones, you need to keep coming back, and it's totally the person's got all this faith in this person, because you're going to listen to a practitioner and you think they know what they're doing.
Yeah. Sets a false expectation.
It does. And I've had a patient years ago, and this was memorising. This particular chiropractor was seeing this lady, and she came in, she had psoriasis. And he told her psoriasis was coming off from her spine. And adjusting her is going to get rid of the psoriasis. So she's come to me thinking I was going to be the same. And I told her very, very quickly that no.
Doesn't make sense.
That's not going to happen. And then I looked like the idiot.
This is what happens.
Like, what? My other guy told me that. Oh, you mustn't know what you're doing.
That's the
And
the
look, I've
consensus,
got
isn't it?
no problem with that. I mean, don't come back.
Yeah, you've got more
But
experience.
I'm gonna tell you, because I'm not gonna bullshit you and tell you that I'm gonna adjust you all this time. Your psoriasis is going to get better. I think as a profession, have set us up. We've set ourselves up to this over the years.
Yeah.
Everything was coming from the spine and that, and we can cure this, we can cure that, and we can do this, and that has what has got us traditionally in trouble.
Yes.
And that is why the medical profession's going, oh God, And there's people out there, and look, that's up to them. That's entirely their thing. If they want to continue treating people like that and believe all that, fine, that's fine. But I'm over here, and I'm doing what I'm doing, and I'm happy not to bullshit people. But I think that traditionally has got us in trouble.
And that is something as well, where setting realistic expectations, and it's the same again, it's probably the same in every industry as well. You're right, you look like the idiot, because you might be the odd one out, but you're actually the one who's doing things more accurately.
That's right.
And genuinely.
And at the end of the day, I don't manipulate or adjust everybody. So I do a lot of active release techniques. So the person comes in and they've got a restriction in their neck. And I'm like, oh, well, that feels like that's not moving. But I'm going to release every bit of muscle tissue around that joint and come back and retest it.
Yeah.
And lo and behold, if it's still stuck, well, the joint's the issue. And I'm gonna politely ask them if they'd like me to manipulate that and get that moving again. And if it's moving fine, well, what would I have been doing had I not done the ART and just gone, that's stuck, I'm going to adjust it, boom. And then they're going to feel good for about 5 minutes, 10 minutes, and then that's just going to come straight back because that muscle's holding on like that.
Correct.
That is the difference to what I do.
Because it's temporary. A lot of people get temporary relief and go, oh, that's it, but then it just comes straight back because you're not actually treating again the cause. It's just something connected to it.
And there is some chiropractors that they do what's called the flying 7, and they'll adjust one side of your pelvis, 2 in your lumbar spine, 1 in your thoracic, 2 in your neck or something, and
right.
They'll do that to everybody.
Yeah, the flying.
They'll just
7.
line you up. And this is quite funny. And it's not, this is kind of...
It's serious, but...
Well, it
funny.
is, but it's funny. Some people get better. Some people get better at that.
Is that like the shotgun approach? Just
That
basically
is a shotgun approach.
throw something at the wall, something will
That
stick
is just,
eventually.
I'm just going to do this, and miraculously, some people just get better.
Do you think that partly is due to placebo as well?
Possibly.
And, good point actually here, rest. If sometimes someone has been told, hey, yeah, you know what, maybe this injury or this particular movement, you know, has hurt you,
yeah,
and then they do the adjustments, and that patient listens, because a lot of people, you know, we're all about trying to do what we can and work around it, right, which is good. We don't want to just isolate people, just to be clear.
Exactly.
But sometimes it's okay. Well, this is with this specific, like me, barbell. Don't load the spine right now. You can work around it, right?
Yeah.
And then they don't, and then they go, oh, got better. Well, you go, yeah, you might have got better anyway if you just didn't do the thing that was antagonizing it.
Exactly.
But then sometimes they go, oh, it was when you cracked me and did all this that did it, and you're like, no.
True.
And then there's the problem. It's like when people blame coffee for having great energy levels, so you might have just had a really good night's sleep.
Yeah, exactly.
But it couldn't have been that, because that's too easy.
But you know, the complicated cases,
they
ain't going to get better with that.
If anything, you could possibly.
You know, if someone coming in with a bad elbow and you're doing that to the spine, their elbow's not going to get better.
No.
So you know, this is why, you know, if they're coming in just for wrist, I mean, I treat wrists. People come in just with a wrist injury. Yeah. You know, I'll do ART on the wrist, I'll mobilise the wrist, do something, then give them a strength exercise afterwards, and they get better. You know, and identifying the aggravating factor is a big thing too. You've got to identify what's aggravating it, because I've got people that come in that, you know, get off a chair's hurting, and they don't realise that every time they get up and they're getting off the chair wrong, because there's a right and wrong way, particularly when you've got a bad back, that's actually making you hang around. I teach them, this is how you need to get off the chair.
Yeah.
They go away, and in a couple of days they're heaps better, where they've been suffering for weeks, because every time they get up, they take 2 steps back in their recovery because they've strained it again, because they're not using they're using their back and not their legs to get up from the chair. It's being able to identify that, and that comes down to the history again. What makes it worse? What makes it better? And once you start identifying what's making it better, you need to get them to do more of that and less of the aggravating factor.
Yeah, and that's again comes down to that spending time, asking the questions, and doing the assessments.
Exactly.
Which people just don't want to do.
No.
Which is, and then like you said, it's over time, it's that amalgamation of experience, and I imagine, and I want to get onto this now, where having someone in front of you, and over time, the more problems you solve, the more tools, if you like, to your belt, you go, I've seen this before. You'll start going, in your head, in the back of your mind, you're going, tick, 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 this, I've had it before.
Yeah.
You can't be sure, but then you'll confirm your belief, test it, and go, we know how to fix that one.
Yeah.
What I wanted to ask you is, what are some of the most complex or extreme cases you've had that have walked in the door, and what have you learned from these individuals? Or these cases, these people, these ailments, if you will? Because there is some people who are on, you know, thin ice, to put it lightly.
Big time. Look, I think the most common thing I see is people with disc herniations.
Yeah.
And they've just been mismanaged. You know, I've had people say, oh, they'll go to their doctor and go home, lie on the floor, put heat on it. Now that's...
The doctors are great when it comes
Or
to
go
that,
home
aren't
and
they?
go home and lie in bed. I mean, it just doesn't work. They just need, number one, they need some to get the right advice. Definitely don't lie in bed. I try to keep moving within reason. I mean, you're going to have to sit down, you're going to have to lie down or whatever, but you need to also just get up and move when you can.
Yeah.
And it's amazing just knowing what these people need to avoid in aggravating, like flexion. You know, I'm bending forward, I'm putting my shoes on. Well, you're aggravating your disc. You need to completely eliminate that. And you need to have some tools up your sleeve to help minimise that. And Stuart McGill's book, his stuff is just gold.
Mate.
His book,
I'm loving it.
and all these graduates that come and see me and go, oh, Matt, what's the best book? I said, see that book there? That needs to be on your shelf.
Well, I came in, didn't I? And I asked you, and you just went,
Yeah.
And pulled it straight
Lower
out.
back disorders. And like he's got other books as well for less academic people, which are written in a way that helps you understand. Then there's the one that I've got, which is just fantastic.
It's blowing my mind, I'll be honest with you. Like, I've learned so much from it, and even without
amazing.
working out of my scope, helping people identify the role of the spine more specifically, and again the movement. I'm sitting there going, because everyone's got back pain. Like, I don't have bad back pain, but now it's like I get it.
Yeah.
I'm there and I'm learning all the time. I've changed my seat, my position. I'm going right and flexion, extension. I've got a big ass. Apparently that has a lot to do with it as well. Lying down. Because when you lie down, if you have a firm mattress and you've got a big ass like me, because think about it. You're in like this extension position, right? So if the mattress doesn't sink you in, you can't get neutral spine. I'm like, and I'm thinking back when I really go, no, that's when I slept on the mattress at the hotel. It was so good because it was soft.
You've got to have an ass reduction.
Well, it's like I don't need no BBL, man. Those people need that shit. But but that's the thing. He goes people with a bit more meat on the ass. But it all makes sense, and the way he explains it. But yeah, that is absolutely fucking brilliant.
That's huge. I turn them around quite quickly. Yeah, and unfortunately, there's the ones you can't help. They've really blown it out, and it's a matter of you just trying to get them into a good surgeon because they've got nerve compromise. They're starting to lose muscle mass, or they can't feel their limbs or something like that. That's bad. Or they're having some bowel and bladder problems. So that's a problem. Other than that, I mean, I suppose the worst things I see are people that actually have some significant pathology, and it's a matter of just picking it up and going, this is not where you need to be. You need to go back to your doctor. Yeah. You see all sorts of things, bone cancers, tumours in the body that you just think this person's coming in, they've got pain at night time and they're losing weight. Like, you gotta listen to the red flags. You gotta listen to the red flags.
But sometimes it isn't you. It's not you, is it? It's like, hey, this is not a me thing.
Oh, totally.
This is a.
And that's when
you've told me this.
And that's when you gotta really move fast and find them someone that.
You saved someone's life by doing that because instead of fucking around with them.
Well, yeah.
Probably have.
Yeah. I've lost. I mean, I've been a practitioner for 20 years. I'm sure there's things there. One of the biggest ones years ago was an older gentleman, and he ended up with multiple myeloma in his spine, and I just wasn't convinced that this was mechanical. I sent him off for an MRI. I'm straight on the phone to his doctor. The doctor was actually quite surprised at what I was telling him on the phone. I was just going through the whole. He's got this symptom, this symptom, this symptom. You need to test this in the blood. Oh, right, yeah. And I think he realised, oh shit, this guy knows what he's talking about. And it was there. And I think, we got him some prolonged his life a little bit, but I mean, ultimately it was, unfortunately,
riddled with it.
Yeah, he wasn't going to survive. But it's things like that which helps. But also just getting people's lives back from having a serious disc injury, and they're thinking, oh, I'm going to end up having surgery, and they're not. And
Just a quick one, guys, before we carry on with the podcast. For any of you who are interested in taking your health and physique to the next level, and you want to remove the guesswork, you're not quite getting the progress that you want, you're not seeing what you want to see in the mirror, and you're not feeling like you're really moving in the right direction, then click the link in the bio below, the apply button, where you can contact me. We can organize a free consultation, no obligation, and discover whether it's a good fit as coach and client. All right, back to it.
Not a lot of these things end up on the table.
Well, this is another point I wanted to discuss with you.
Depending on who they see and who gives them the advice, because unfortunately a lot of people come to me after they've been to the doctor, and they'll come in and say, oh, I've got this disc herniation, he's giving me a referral to this doctor for a surgery. I'm like, whoa, hang on. Back up there, mate. Have you weakness in a limb? Have you got, you can't feel something? Oh no, I've just got this thing on an MRI. I said, whoa. You know,
Well, that's
so
the best,
many
that's
people
the
are
best one, though.
walking.
They pull it up, don't they? They don't even assess the patient and go, well, you're going to see what's happened. This has gone wrong here on L5, something we need to operate. And you go, hang on, you've not even touched the fellow. You've not even assessed.
No, it's bad.
the
And you know,
person.
the problem with the imaging these days, and imaging is so good that there's people around. I'm probably sitting here. I might have a disc herniation in my back, and they're not even symptomatic. And just because they've got that in MRI doesn't mean that's what the problem is, because they come in and they don't even have the symptoms. No. And I'm like, hang on, is there sciatic pain? Oh no, I've just got some pain in the back. I'm like, whoa.
No one's asked these guys.
Don't
not ask them the question.
No, and this is what is frustrating to me. You know, you do have your odd medical doctor out there that is good at assessing that stuff, but some of them just get the MRI. Oh, you're off you go. You know, I'm like, no.
Well, that's it. They're just sort of like on a conveyor belt.
No, it should.
How many people?
It should be the last resort. And like I actually work closely with a neurosurgeon here on the Gold Coast, and he is totally conservative. Operation is the last resort, and he'll do everything he can to avoid that.
I think that is and should be the philosophy, because ultimately it is the last resort, not from a subjective but from an objective position. If we look at this practically, once you start opening people up, you're causing massive trauma. So I always say to people all the time, like for example, the effect of strength training is real. It's powerful, right? It's physical, but it's external in terms of it doesn't go inside your body, you know, but it obviously has an effect. But nutrition goes in, and therefore, and they have different roles, it is, you know, a big part of changing the body composition, if not the larger part. And sure, we need the stimulus from weight training, but when we look at energy balance, it's like it's internal. So anything where you're going inside and you're cutting through tissue and muscle and even bone sometimes,
We are creating scar tissue as well.
you don't want to fuck around with that.
Yeah.
That's the last, like you said, it's the last resort, because it's going to cause the most stress on the body, isn't it?
It's not good, you know.
And a lot of people, I've actually got a friend of a friend, and his back's fucked, and he's had that many surgeries, and it's getting worse.
Well,
I mean, knowing what I know now, and it's easy, right, for me to just say, oh, do this, but man, if that guy saw fucking someone like Stu, or read his book, he might have saved himself from all of this.
Oh, totally. It's scary.
Because they're just going, oh yeah, do this, do that, get in, rip in, and oh, that didn't work, we'll do that. You're fucking someone's life right off.
Yeah, I know. So 2018, I somehow herniated a disc in my neck. I still can't tell you to this day what happened. So I had absolutely no pain, which is bizarre. And if I didn't know what I knew, I wouldn't have picked it up.
Yeah.
So I found that my tricep, when I was working on someone, was just fatigue. I'm pushing on someone, I'm doing some soft tissue work on someone, and I'm getting, you know, when you've done too much in the gym, you just feel that's starting to fatigue a little bit. And I thought, gee, that's weird. And then I'd be outside at the house, and I'd be doing something outside, and you know, you'd be resting on the floor with your arms there, and your triceps, like you're just holding your body up, and your triceps, like, wow, what's going on there? It's bizarre.
Yeah.
But then the end of my finger started going tingly, end of my index finger, just the end, just the tip.
Very strange.
It was very strange, and it got worse and worse, but didn't progress. I could have drawn a line around it like this. This is how diverse the body can be.
How specific as well.
So it's been about a week and a half. I thought, this is really strange. I had a petite lady in my room, and I was adjusting her lower back, and when I was pushing on her, I had nothing. I thought, this is just weird. Anyway, I finished treating her, and I said, oh, I'll see you whenever. Then I thought, I'm going to get on the floor here and do a push-up.
No, nothing.
It was a one-arm push-up, mate.
Yeah, it was like...
I got up, but the left arm was doing all the work, and I thought, wow, okay, we got some seriously...
out of whack,
Yeah. Well, straight away I knew, well, what supplies your triceps? The C7 nerve root. And I thought, I just waited to the end of the day, went home, my head's ticking, and I went to the gym. Now, not to do a massive workout,
no,
go smash myself, but I went in there to test it. So I wanted to test my lats, because they have some C7 involvement, and so do your pecs, but I didn't even get to the pecs. So I go into the back area in World Gym at Ashmore, and they've got that pull down, hammer strength pull down, one arm. I thought I'm going to do one arm here.
Yeah.
So I threw on a 20, no problem. Threw a 10 on each side, which would have been nothing for me normally.
Yeah.
So this arm came down, this arm stayed there, and I was pulling with everything I had, mate, and there was nothing there. And I went,
that must be a very strange
It
feeling.
was a really strange feeling. When you don't have that connection there.
It's like you've got the horsepower, but you couldn't tap into it.
I'm like, this is not good.
Was it painful?
Not at all. You've got nothing there. It's a really strange feeling.
Yeah, that's weird, eh? Because like you don't feel it, because like usually...
Well, I had no pain. Now, normally when someone herniates a disc, they get the full-on radiculopathy pain, get the full-on pins and needles. Oh, they can't move their neck. They're like, in this position. I could, no problem. So then I went, I'm going to go in and do a tricep push down. Now, I knew my tricep was rooted, but I wanted to see how bad it was.
Yeah.
So I think 5, it's a starting on 5.
Yeah, depending, but like 5, 7.
And they had the one arm thinger, so I didn't want to do it.
Yeah.
So I'm pushing down with this one going, easy.
Yeah.
Grabbed this one, and I struggled. It might have even been 10K or something. I struggled even to pull it down. I just let go. I went home, shitting myself, thinking this is not good.
Yeah.
Drove like a maniac home because I just had so much going through my head here. I think I nearly took out, they had some roadworks. I won't say what street it was, they might implicate me. And this copper's waving this police officer's waving his bloody
the light
illuminated thing. Yeah. Well, I went straight past him, didn't stop. And you know what, I thought, that was pretty stupid. And I sort of expected someone to come after me, but they didn't. So I went home, and then I'm thinking, okay, I texted a neurosurgeon friend of mine. He said, mate, we've got to get you in for an MRI ASAP. I said, yep. And then, he started talking about strokes and stuff, because in 2012, I had a stroke.
Yeah.
And I said to him, look, no. I said, this is contained to just the C7 nerve root.
Yeah.
Still didn't make sense with the finger.
Yeah, that would have been odd.
Because prior to me, the strength really going, I thought I might have been developing some carpal tunnel because I've used my hands all the time. And
yeah, but it would have been strange that it would have been isolated to the
well, it was
top
just
of the
bizarre. Even that's bizarre. So C7 traditionally is your middle finger. So I had absolutely no symptoms in that middle finger whatsoever. So
there was things that were making sense and things that made no
exactly.
sense.
So then I had the MRI, and it's a real trip when you're looking at your own MRI, and normally you'd be saying, when it was a patient, you're looking at it going, oh, fuck, this person's rooted. And to see my neck there and to see what was going on was really bad. So what had happened is I had a disc herniation at C7. It was actually still contained within the vertebral column there.
Yeah.
It was pushing on the motor part of the motor neuron of the spinal cord. So you got your motor and your sensory coming off your spinal cord.
Yeah.
So it was hitting the motor
and pushing it up.
Just pressure on it.
Right.
So it wasn't even getting to the foramen where it comes out here and out this way.
Right.
So if it had have been, I would have been lit up like a Christmas tree. I would have had the full-on radicular pain. I would have had the pins and needles, like full-on electricity type pain there. So it was still contained within that. But the fact it was pushing just on the motor nerve was why I had nothing. I was losing that strength there radically, and I was also very quickly, and it's scary how quickly this happens, starting to atrophy.
Yeah.
I could see my triceps going. I could see my lats going.
Yeah.
My chest going. Yeah. And I was shit. And then I saw my neuro guy. He goes, "We've got to get you in." Well, before I even saw him, he sent me in for a nerve block.
What does that do specifically?
Well,
block the nerve. What it sounds like.
It was a cortisone injection. It was we're just gonna try this, And I was like, I wasn't that confident it was going to do anything because I actually didn't have any pain.
Yeah.
You know, they can work really well for people that got the full-on ridiculous pain, but I think he just he just wanted to try this because he's very conservative as well. And I had that, and over the weekend I'm going, and I knew that wasn't good, and then I had to deal with the fact that I know where this is heading, and I had to get my head around that because being a chiro and surgery being the last resort for most people, here I am and I'm faced with this is, otherwise I don't know if this is ever going to recover. And the fact that I've loved my weight training, you know, and I'll tell you what, it's a mind trip, and you could relate to that if you started seeing your tricep and your lat disappearing. And the fact I'm like, I need my arm to work.
Yeah, exactly.
Like,
it's everything.
Yeah, I've got kids, I want to play with my kids. So went and saw him on the Monday, and a week later I'm in surgery. Disc replacement, C7.
Fuck me.
Yeah, fuck me. Fuck me, mate. That was stressful. Like, I must admit, like, I've had a stroke in 2012.
Yeah, which I remember
but
that.
But it's a funny thing. You have that, you had a stroke.
Yeah.
You got to fucking deal with it. Here I am faced with the fact that I've got to go in and have someone's got to go through the front of my neck and go in there. And
I was going to say they're very
there was a
good
lot,
now the way
they are, but
you know,
there's still a lot to think about.
There's a lot going on there.
Yeah, I know.
You can't exactly fuck that up.
No. So
is he your friend as well? Is he doing the procedure?
Yeah.
So, well, at least there's some level of.
Dr. Neil Cochran was a neurosurgeon, and he
he the guy you spoke to about my neck as well?
Yeah, okay, and look, he is so good with necks. He is the neck guy. And I've seen a lot of my own patients with him, and they're fantastic. So I have it on the Wednesday morning, 6th of June. I'm out Friday. I'm home Friday.
Yeah.
I'm back in the gym in 6 weeks. It was bizarre. I hardly had any pain.
Did you say it was replacement?
A full replacement. From what I understand, it's a titanium disc that they put in there. It actually has a little bit of flexion, so it does actually move a little bit. And the reason he did that was because he said, if I fuse this,
oh no, you don't want to fuse it.
You'll be back here in a year.
You lose the motion
well,
of it to a degree, don't you? And it doesn't give it the natural.
No, look, I don't think so, because it's so far down there. 70% of your rotation occurs around C1-2.
Yeah.
And like, I've seen people with the naturally fused with it. They've still got movement there.
Yeah.
Just that one segment. But what it does, it puts more biomechanical stress than the one above. Yeah. So he's like, you'll be back in here a year later. We'll be doing the next one.
Oh yeah.
And you know, I do have the foramen on both sides at C5-6 is actually closing up on me now too.
Right.
So I'm still dodging a bullet there, but it was amazing. I came out. I was very, very careful. I thought, you're like, oh my God, I got this thing in here. Be very careful. But I had my recovery was amazing.
Yeah.
It was unbelievable. You don't see that in lumbar spine, so.
Yeah, I was going to say that's because it's a completely different animal.
No.
It's a much.
Well, they go through the stomach. They're going to remove your intestines and stuff. Goes through.
Fuck me.
Oh no, and I actually said to him afterwards. I came back into his office and I said, look, I've been thinking about this. This can't be real good in the lower back. And he sat there and he goes, no. And so this is why I love Neil.
They don't go in from the back. Ever.
Not for a disc replacement. They go through the front because they've got to pull that disc material out and they wedge that thing in there. But
this guy's doing some serious stuff.
And
wow.
This is why I love Neil, because he was like,
interesting.
Straight away he goes, no, I don't like him. Like he's like.
That's his last was he can work around.
So yeah,
there was nothing he could do to move.
No.
What that off the motor,
mate,
you had to replace
it. It was.
Oh, so your disc was fucked?
It was fucked.
What caused this, do you think?
I don't know.
What do you hypothesize with him? Is it maybe training over the years and just doing shit, maybe like
no, look, I had a neck injury back in my 20s. I was doing martial arts and we were doing these, I springboard off and did a forward flip.
And you landed on your head.
But I landed, like we had this big foam, the big gymnastic mats, but I landed on the base of my neck badly.
Yeah.
And how I didn't put my chin through my sternum, and I would have been early 20s. And I actually think, see, this is the thing that happens to people. They'll have an injury 20 years ago. And you'll injure that area and, 20, 30 years later, it'll come back to haunt you. I see that a lot. I see people that come in, their lumbar spine's looking great. Except L5, S1 is squashed. And the rest of it's normal. Now, normal degeneration will cause a consistent wearing pattern through the whole spine. But when you see a perfect back, but that lower back they've had an injury. They've had a compression injury. Something's happened to that disc that caused that. Yeah, so I reckon that's probably what's happened. Yeah. Plus, heavy weight training.
So I imagine, can you now vertically load the spine still?
At
all?
I choose not to.
Yeah, I get that. It's just not worth the risk anymore.
No, we'll see.
The juice ain't worth
in
the
March
squeeze,
this year, in April, March, I ended up getting all this burning in this arm. And, I'm thinking, that one above's come back to haunt me. Yeah. And I was getting back into my training and I was using this V squat machine in World Gym and it was coming across here, right? Now I was getting up around the 140 mark. Yeah. I think the compression down on that was irritating, has done some sort of irritation to the nerves coming out of my neck. Because then, So it's settled down, thank God. And now I just use the belt squat machine in the gym. There's no load on my neck at all. I'm loving it. It feels great. I just don't load my neck at all anymore. Yeah. And I was a bit naive because when afterwards, I'm like, get back into it. You got to realise, I finally realised I am nearly 48, and you can't be training like that, And it's funny. I even see the guys in the gym now looking around. And I go, I had a conversation with a guy a couple of months ago. I said, mate, wait. I said, wait, you think you hit 40, buddy? Some of these guys just need to realise that it's not about how much you're lifting. It's not. It's about techniques, about feeling the movements. And look, honestly, I wish. How often do you hear this? If I knew what I knew now, I'd go back and do things a little differently. But I did fall on my neck badly when I was in my early 20s. I did a lot of crazy stuff in the martial arts, a lot of all sorts of stuff. So I think down the track it did have some sort of. But at the time, I actually have no idea what happened, because I didn't just do it like most people didn't go and can't move or they've got sciatic pain. It was just a gradually. I picked up. I had the weakness there, and even the radiologist mate of mine at Queensland X-ray said to me, "How do you pick this up?" And I told him. He goes, "You're lucky you know your stuff." He goes, "Most people would think this is odd. I'm a bit weak." Like your lay person would be going, I'm a bit weak, but something's going on there. There was no pain. What brings people into doctors and stuff?
Pain.
Into me, pain. There's something going on here. So I was just lucky.
I should be right. It's like, but it fucking might not be, mate. Prevention is always better than cure, as we were talking about.
Well, that's
before
it.
We started this podcast.
And that's another thing. I just knew that's weak. Well, I didn't know that was weak, but I knew that was really weak. And I thought, that's got to be connected. And there's nothing else going on. I've got to be connected. I was checking my reflex was down. I've got other practitioners going, check my reflexes and do all my myotomal strength, and everything else was fine. That was just that C7. It was pinpoint, and on the MRI there it was. So lucky.
Yeah.
Lucky.
These experiences are eye-opening. To say the least, as well. Especially when it comes to those things in the spine, you just take them. And I'm sort of thinking as well with with mine. I was like, I'm trying to problems, because there was no dramatic event. But I was looking, the more I look back over the years, and I'm like, there was a bit of that, there was a bit of that, and it must be somehow along the way there's been that. But once again, coming back to what you said, Matt, it's, I wish I would have had someone to teach me better technique on certain movement patterns. I wish I could have understood it a bit more, and it's like, that's why I'm so passionate about doing what I'm doing now, like you are.
Totally.
You want to help, again, it's prevention rather than cure. Let's not even get there, because we won't even cause that, because we're not even going to do this. We're going to do it this way. Yeah. And again, it's this skill acquisition.
And you know what I find with a lot of people too, it's the patience. Some people don't have any patience. Like they'll come in with a shoulder injury, and I've had plenty of shoulder injuries in my time, and I'm like, the first thing I say to them now is, prepare for the long haul.
Yeah.
because this is not going to be better in 2 weeks.
Better to be realistic with someone.
You know, and as long as you can get them straight away and say, look, you need to know this is not going to go away in 2 weeks, because your shoulders do everything.
Oh, man, it's such a complex
Even
joint.
sleeping on them wrong hurts. So you've got to try and minimise the whole strain on them as much as I can. I try and this is where it does come in handy that I've done training in the gym before, so I know you need, and having the experience of hurting myself, what you have to avoid,
this is what helps.
What you need to start doing, and it helps greatly. But you know, it's a matter of that then is the patient's responsibility to listen to what you're saying, because some of them don't. They just keep doing what they're doing. I'm like, well, you know, if you're not going to listen, you're going to end up tearing this really badly, and you're going to end up in the surgeon table.
Which is, again,
which, you know, not many shoulders are successful in the surgery compartment. So
no, it's such a complex
it's so complex. It's the most complex joint. So I mean, they've just got to be.
People do more damage as well, and I often use that verbiage with people.
Yeah.
So, you know, 'cause people, I want to do, and I said, look, I understand more than ever how much you love your training and how you want to continue training. But think about this: wouldn't you rather still do this? It's something better than nothing, rather than still trying to do this and then fucking yourself up more, and then having 6-12 months, or possibly never being able to do it again.
Totally.
Think about that, because that consequence is much worse. And I always say, you know, it's a grain. Like let's say it's a 6-month recovery, but you can still work around it in some capacity, unless it's something that's very, say, extreme. Usually, you know, you can do something. It might not be perfect, but something's better than nothing, right?
Yeah.
You find a happy medium.
Yeah.
6 months is a grain of sand in your training career, really, if you're going to continue to, and you want to do this for a long time.
But you can train around stuff. Like,
this is the thing, and
that's what I say to
sometimes
people.
you learn stuff by doing it. You're more fun.
Exactly.
I've become a better trainer since this happened to me.
Yeah.
With the C5, C6 annular tear, because I've had to really go, you know what, maybe I was putting SBD on a pedestal too much.
Yeah.
And, you know, and again, I knew it, I understand, if you can load a muscle, you can grow a muscle.
Yeah.
You know, so it's like, you don't need these movements. They're great, and you can still have those movement patterns.
Yeah.
But they might not need to be barbell-esque. They might not need to be the traditional.
Yeah.
There's other ways, and that has helped joints, recovery, I think development. It's helped me with other people as well, navigate and pair them up with better curriculum, if you will.
And people's anatomy is different too.
Some people are just not designed with the femurs and the limb lengths.
I've listened to Stuart McGill as well, and I've seen a couple of his DVDs, and I've got them, and they're fantastic.
Yeah.
Not everyone can squat ass to grass.
No, that's the biggest thing. People think you got to go after even I can lose neutral spine. It's shit.
I know, but how many people?
It's like, you've got to do that. That's how you do it.
I see all these young guys that come into me, and they're training with their mate, you know. And I had this young guy years ago, he's 18, and he was fairly tall, fairly lanky, and I said, do a squat for me. He goes, I've got bad back, I'll do a squat.
You got bad back at that age.
He goes down, and he's trying to go right down, and he's way past where his spine's gone into flexion.
Yeah, he's been
and I go, okay, that's great, go back up, squat, and I'm going to tell you to stop, and you're going to stop.
And he's going to think it's a half
And he's
squat.
gone half down, and stop. That's where your limit is. He's looked at me.
Yeah.
Oh, don't worry about your mate.
Don't worry about your trainer either.
This is where and I explained it to him, and it's fine.
Yeah.
I don't have to do much.
Yeah.
And this is the thing. Well, I'm not going to see him 3 times a week for 6 weeks. I'm going to find out what's causing the problem and move him on. And he'd been fantastic since. And people's hip joint anatomy as well, they can't always squat down like that. And when they've got that more mobility around their hips, they can do that. I had this guy years ago, he was doing CrossFit. I said, do a full squat for me. Mate, I've never seen anybody squat like this guy.
Oh, right.
His back was dead straight. There was no, and he went right down. Now his hips, it's anatomy.
Yeah, it is. Well, it's like the Asian community, the great Olympic lifters.
Yeah.
Their femur is not deep set, and it oscillates in such a way. And it's like, say, Scottish, and they've sort of, you can kind of compartmentalize some, not everyone, because everyone's individual, but there's certain geographical regions of the world. Some people are just better, and you're right, they just sit on their heels, and you're like.
But look at the Chinese. They'll be in the street markets. They're squatting.
Exactly.
And
it's cultural.
But we lose that as.
We look at a kid when they squat, it's like fucking
my
brilliant.
son,
Ass of the
my
grass.
son.
Yeah.
Perfect.
Yeah, and you're like,
And
you
I'm
fucker.
and I'm watching it, I'm going, this is amazing.
I know, and you look, and it's like,
And
what
you
did he taught
lose
you
it.
that for?
But you lose it.
that is the ironic thing. You can actually do it right when
Exactly.
you're malleable and flexible, and then you grow up and you basically fuck yourself up.
Things start tightening up and it doesn't happen. So, yeah, it's just amazing.
The young blokes, you know, it's really scary. It's upsetting as well. And me and Aaron and Bree and a lot of the guys here, we got a good crew. We go around, we help a lot of people in our time. When I'm training, my training sessions be up to 2-3 hours where possible, because I'm going around helping people.
Yeah.
Where I can see they're open to it, the amount of people's backs I've prevented just because
These aren't even your clients.
These are not even my clients.
But
This
see,
is how I've got a lot of
but
clients.
This is what's
but
missing.
inadvertently.
This is what's missing in most gyms.
You need someone
Not to write
facilitating.
it. Where's that gone?
But the thing is, the lads are there, and I've had to pull a few of them up because they're getting trained by individuals who will not be named, who are doing things that are far-fetched. And these guys go, well, he's training me. I had a guy told me Eddie Hall taught him to squat and deadlift. I said, oh, you know Eddie, do you? He goes, well, I said, so no, he taught you to squat, did he? He goes, well, I watched a YouTube video. I said, look, that ain't him teaching you how to squat. I said, he's a world-class athlete. Yeah. He's also an anomaly. He's super specific. He's done all sorts of shit and he almost killed himself. And I love Eddie. He's a great guy. He's a top bloke, right? But here's the thing. He didn't teach you to deadlift. I said, right now, what you're doing, if you want to keep deadlifting and you're 16, I said, you're going to fuck your back up. You've already got a bad back. You have, haven't you? Yeah, you have. I know you have because I've seen you walk away from the bar and I've watched you do it. And I said, now look, this is what you've got. I said, look, and I get it. I said, you want to be big, you want to be jacked, don't you? You want to look good. Yeah, you want to be like a beast, right? No, because you have to get on the language. You have to get on the same level. And people listen. When I was squatting and deadlifting and I'm putting on some big numbers when I was doing it, people listen to you more. It's wrong. Because what if I was a knobhead and I didn't have any clue what I was doing? They'd listen to me purely because of the way I was lifting, right? Yeah. So fortunately, I've got a bit of nous about me, and then you can use your clients as examples, or they look at you when you're pumped up and it's wrong, and then they start to listen to the young guys because they go, oh, he's strong, he's and it's wrong. So you got to get on the same level. But you say, guys, look, I get it. Trust me. I get it. I know what you want, but trust me. If you want to continue doing this and you want to look the way you want to look, right now it's short-lived. There's a guy in there, he's 17, he tells us the other day, he goes, so how's your training going, mate? Oh, not so good. He's already fucking pulled the disc out. He's done a disc apparently already. I said, mate, you're 17. He goes, I know. I said, look. And he goes, I should have listened. I said, mate, you're
wrong.
17.
It's wrong.
These got all bad backs. These guys are all teenagers. They're just trying to watch YouTube, deadlift, squat as much as possible. A lot of them are now taking drugs already, and you're going, lads, you're going to be done by the time you're 20, man.
But this is what's missing, and it's good that you guys are doing that in the gym here.
Mate, we love it.
Because when I was training, years ago, there was a gym here on the Gold Coast called Muscle Fitness.
Oh, yeah.
It was down on Ferry Road.
That would have been the place, mate.
It was the place to go. And they had people there. And this is back in the day before you guys would be paying rent and you'd have your clients, right?
Yeah, people
on
the floor.
So they would employ someone there.
Yeah.
And they'd walk the floor and they'd come up to you, oh, you're doing this wrong. That is missing in most gyms today. I train at night time. I come home from work. People are like, how do you do that? I don't know. If I don't train, I go nuts. I can't train in the morning, so I'll come home. Even after last night, I was trained last night. I was in there at 8:30.
It's therapy.
It is. And you're looking around, and honestly, there's people doing stuff wrong. There's no one walking around, no one helping them. And I'm not inclined, because I've done this in the past, I've actually come up to someone and said something. You look like an idiot. What the fuck are you talking about?
Yeah.
Who are you?
Yeah.
Oh, okay. So I just sit back and watch for the injury to unfold, and then I can throw a card at them, say, come and see me, I've been watching you over there, because they don't want to listen.
No, and there's a way to do it, but still, it does help when you've got a shirt on, branded, and you get someone in who is, who does know what they're doing. But like you said, some people don't want to know. No. I mean, and sometimes age is a factor as well. You try and tell some of the old blokes, they look at you and go, what do you know, I've been doing this longer than you've been alive. And you go, yeah, but you still look like that.
But it's amazing though, when I'm in the gym, the older people have the form.
Well, that's the thing. The old school people often do it.
The young guys, they're trying to deadlift all this weight. They don't even and this is another thing where it comes down to anatomy. They don't even the anatomy of it. Like the guy might be 6'5", he's a string bean. He's trying to do a deadlift of the floor, lifting all this weight. He's rounding his back. He can't even get his hips down there to get it properly. And I'm like, oh, this is bad. This is going to end badly.
Something that I've started doing. going to record one in a bit, is I started with these mics doing these little tutorial videos in the gym.
Yeah.
I'd throw the mic on and I'd be like, guys, today we're going to do deadlifts and just base split it up. And it's like a couple of minutes.
Yeah.
And the amount of reception that got from people going, shit, I've been training with a guy for years and you've just explained it better than anyone ever has. And the only reason, and that's not to blow smoke up my ass, and the reason why is because, and I'll tell, this is a real life story, I'll probably tell you this. I had a master's student, right? So he knows what he's doing. To teach me how to deadlift, I was 16.
Yeah.
Sorry, I was 17. And I had 60 kilos, never deadlifted. Didn't know do deadlifts. Apparently you gotta do deadlifts, right? Pull my back out, first go, boom. First go, pulsing up my back, 17 years old. I was watching these guys, a bit older than me, doing 180. I felt like a right tit, because I was like, fuck, I want to compete with these guys. I can't even do a deadlift. So a horse dentist, that's right, a horse dentist, an ex-gangster, right? At my gym, he used to be Olympic lifting, and he'd have dress shoes on. And I'd go, hey, and you'd think, oh, what the fuck's this fella doing? Immaculate form. And I said, oh, I went in, I said, Paul, I've done this. And he goes, oh, I said, and he goes, oh, I can teach you. Fucking brilliant. All right, basic stuff. There was a lot more to it. But it just shows that someone who was on the tools doing it could articulate it to me in such a way. And what I'm getting at here is not always the person with the piece of paper, but just having and being able to distill a complex movement, or even something that can look simple, into applicable takeaways is key. And when you do that, and this is what I was really frustrated as a coach, but also as a trainer, because I had a lot of lack of development. I think a lot of the injuries, because no one was able to communicate that. I actively did reach out, and I was looking at YouTube videos, and I paid trainers, and fortunately I found good ones, because I'm relentless finding good people like yourself. And it was finding that information, and now I'm able to, and I'm continually trying to refine it. I'm like, without oversimplifying it, how can I give you, again, the 80-20 rule, the 20% that gives you 80%?
Yeah.
And it's just being able to say to people, first of all, understand how the body moves, understand individuality, this is how to set it up, and here's the fundamental principles. Here's the actual movement pattern. You break it down, you make it so simple, and people just go, that makes sense.
Yeah.
And then obviously, you know, there's this specificity within that with different people, but it's just not, and this is always what I'm talking about, Matt, and you just said it, there's no one like on the floor when you come into the gym going, look, we're gonna give you 1 or 2 free, right? It's part of your gym membership. It'd be an investment for the gym, but I tell you what, it'd be a hell of an investment, because you get people ending up investing more time and money.
I just don't
just saying,
understand.
look, let's just do a basic session. Let me just teach you how to do a squat pattern, body weight, deadlift, hip hinge, isolation, press, pull, whatever it is, right? Shoulder blade retraction, all this, but oh fuck, mate, how much less injury would you see, and how much better results would you get?
I don't understand why they're not doing this now, mate. I just don't know why that's happened.
I started on the gym floor doing that in New Zealand. That was compulsory. You had to do it. But now, but again, they've shortcut it. Just get them in, pay the rent, sweetheart.
Yeah, no, it's just, I don't know. It's missing.
Big investments.
They're missing that. I just don't get it.
Yeah, which is a shame. But
it is.
Hopefully, there's good people who, you know, and they are out there.
Well, it's great that you've got a team here that'll stop and say, hey, you know, you're doing that wrong.
I train all my coaches and where possible, clients who get experience to, at some point, hey, if you think you can help someone, here's the way to do it diplomatically.
Yeah, totally.
But help people, especially if it's dangerous.
Yeah.
If it's not, it's like CPR, you have the right to not, right?
Yeah,
you have the right to walk away, it's your health.
Yeah.
But if I see someone doing like red flag, I'm gonna help them, because I'm obligated as a trainer. Totally. If I'm turning a blind eye to that, I gotta be, I'm not sleeping well at night. I gotta be going, look, even if they have a go at me, I just said, look, due diligence, at least I'm gonna tell you, you're gonna really hurt yourself. And I had to sell one of the young blokes one day. He was looking at me, he looked at me, he was putting the weight on, he had 180 on the bar. He barely deadlifted, I think it was 120, and then he tried 140. I think he barely got it up with a rounded back. And he looked at me, and he looked at the bar, and I was looking at him with my client, and I just went, and he sort of went down, and he pulled it, went for going, and he went, no, he tried to jib up, and I just looked at him and went, don't. And he went, what do you mean? I said, well, do you think you're gonna lift that? And he goes, no. I said, how'd that last one feel? He goes, not good. I said, mate, trust me. I said, not why I'm here. You're gonna hurt yourself.
I don't understand.
Your time will come, but right now there's no way with that technique that your mass can overcome that load effectively.
I just don't understand why you'd even try that. It
was just in front of his mates and all videoing him. I'm like, you're gonna video your mate pulling his back out.
Yeah.
But it was to the point where it was so heavy, he was never even going to move it. Yeah. So it was almost like it was that heavy, it was safe, because he was never going to get it off the ground.
I just think.
But I just thought, what is going on in your head? But poor bastard. But they're doing it, and I'm not here all the time to save that.
Yeah. I just don't get it.
You know, so you can only try. But again, a lot of takeaways there for people. Before we wrap up, I've got some rapid fire questions I like to ask all my guests. They're a bit more fun, light-hearted before the last couple.
Sure.
Before we get into them, the one thing I would say is, in theme with what we've been talking about, if you had to offer any advice for people listening to improve their health based on your knowledge that people could do every day, could be, you know, getting up, standing up better, whatever it is, just basic things, and I know there's a lot to it. What's the one thing that you think that can add to people's health that they can sort of go, hey, you know what, based on what you see with a lot of people?
I just think people need to move more.
Yeah.
There is a lot of static, a lot of sedentary. People don't exercise as much. People's diets are crap. There's too much sugar. But if I see people come to see me, the ones that have the most problems are the ones that are just couch potatoes and don't do any exercise whatsoever. I'm like, for God's sake, just get out and start moving.
Yeah.
The human body's not designed to sit.
No.
Right? And this is the problem. This is why we've got a back epidemic. People sitting on their butts. We are going to have, if we're almost not there now, a neck pain degeneration epidemic with the use of these
people
mobile
walking
devices.
around like that.
Mate, I'm seeing young kids, and they've got their head down, and the parents are here. This is the babysitter. Here you go. And I just don't think they realise that they're causing a problem 20 years down the track.
Yes, absolutely.
That is going to be a big problem. So try and limit. I know it's a pain. Lift it up.
Yeah.
Have it there in front of you on the table or something. This is not good.
No, my neck gets sore from that. When I'm doing posts sometimes, I'm like, hang on a minute.
It's not good. So, and you can get these desk things now. You can put your phone on, but I think you need to change some of that stuff. I think people need to move more. Absolutely. People need to reduce the amount of sugar that's in their diet. I mean, you know, these are all the traditions, alcohol intake. I mean, smoking to me is just out.
Yeah.
I mean, I don't understand why you'd be sucking something down to like 4.6.
I mean, if you want to end your life quicker or take away from it.
63 chemicals in a cigarette that cause cancer. Why are you going to suck that down? I don't understand.
Well,
so, you know, I just think people need to be conscious of what they're putting in their mouths, and they need to move more. The biggest thing is movement. I just can't get these people are just sedentary, and they have all these problems. And then the sugar intake, and the next minute they've got diabetes, and then they've got neuropathy, and then their heart's not good. And this, I mean, they need to move more.
And it all comes down to basics, and that's the irony. Sometimes it's not what you're doing; it's what you're not doing.
Yeah.
I always recite or use a neighbour as an example in New Zealand who was in his 80s, had his own teeth and everything, he was all there. And I look back now with more hindsight, and I'm sure this will continue to do so, but you look at the people who lived the longest, but you look at what they do. They always move, they eat fairly well, they've got a bit of balance, right? They spend time with people, they give back.
Yeah.
They have all of these elements like physical, mental, you know, audible, they're reading. It's like they have these, and it's not magic, but it's the combination of consistency and nothing extreme over time.
No, exactly.
Which prolongs.
Look, I'm not saying I don't ever drink alcohol.
No, that's what I mean.
But you've got to have a balance, like you said. Like, you know, if you're going to have a drink once a week, yeah, great. But, you know, that's good. But don't have it that you write yourself off every weekend. I mean, that's binge drinking. But everything in moderation, definitely.
Well, that's the thing. It comes
and
down
you've
to
also
balance.
got to stimulate your brain.
Yeah. If you don't use it, you lose it.
That's right. I mean, you've got to stimulate your brain. So, you know, sitting on your phone all day, sitting around doing nothing, things are going to go bad. Things are going to get bad really quick.
Oh, yeah.
And the other thing I see with people too, if you think you've got something going on, do something about it.
Actively, yeah.
Don't wait until this thing that you might have is about to kill you, or well, you can't use your arm, or you can't use your leg. Like, if you think there's something going on, go and get some treatment for it. and see the right people. You know, so it's just crazy how many people I see come in and they say, I say to someone, how long you had this for? You know, one year I had this guy, he said, I've had this for 15 years. I've never done anything about it. I'm not looking at you going, do I smack you over the head? Seriously?
Was that going to help? No, that was for being a prick.
You know,
but anyway, no.
I mean, 15 years you've been putting up with this. I mean, you know, go and do something about it. If it's not getting better, go and get something done about it and find the right person. Don't go to the person that's going to see you 6 times a week, for 6 weeks, 3 times a week, and not getting any better. You need to get down to the root of what's going on. You know, stop wasting your money with that person. Go and find someone that's going to give you some answers very quickly.
Yes.
You know, that's what I think anyway.
That's bang on. I think that couldn't be a better way to kind of summarise that. You know,
Totally.
I completely concur. And if anyone takes anything out of this podcast, that should be one of the main things. You know,
totally.
Don't fuck around. Prevention's better than cure.
Exactly.
And find the right people.
Exactly.
Get it done because, like you said,
and if you're seeing someone and you're going back and nothing's changing, you need to move on. That person is not helping you.
Definition of insanity: doing the same thing, expecting a different result. No, but people go, they laugh and they go, yeah, but you've done it, and they go, oh yeah, and I'm like, well, fucking think, critical thinking.
Yeah,
we've lost it.
It's crazy. Well, they come into me and they say, oh, I've been seeing this person for this long, and I'm like, for the same thing, yeah. Well, I'm like, I just don't get it. Like, you know,
it seems nonsensical from your perspective.
Well, particularly if you get them right fairly quickly, and they're thinking, shit, I'm just going to spend all this money, and this guy's fixed me in like 2 weeks.
I think it's a lesson for them. It's an expensive one, but nonetheless, a lesson learned, hopefully.
Totally.
You can apply that to everything in life.
Oh,
as
totally.
Well.
Yeah. So.
Rapid fire questions, my friend.
Okay, let's go.
First one, if you could choose a superpower, what would it be and why? You can make it up.
Fly.
That is the number one.
I would love to fly.
Yeah. Everyone, and I imagine at the minute that would be handy, wouldn't it? Really?
Yeah, it'd be.
Where are you going? I'm going to the old Bahamas, actually. If you want to come,
that would be really good.
Close your eyes.
You bypass any of the airport security and corona testing, and just go.
Yeah.
Awesome.
Yeah.
Yeah.
That would
Definitely
be
flying.
very, very handy indeed. That's for sure.
It'd be great.
Especially in this time, in
Definitely.
this era. Second one would be, if you could have dinner with anyone that you wanted, dead or alive, you can choose up to 3 people. Who would you choose?
3 people.
Yeah, to sit down with. And again, this is now off the top of your head, because
Yeah.
you'll think about this later
No.
and there'll be more people.
No.
You got it?
Bruce Lee.
Oh, beauty.
The Rock. Dwayne Johnson.
Yep.
Yeah. Third one. Probably Sho Kosugi. He was a ninja actor back in the 80s too.
I see.
Massive hero.
There's a theme here.
Yeah.
There's a theme.
Yeah. So yeah, definitely those guys.
Yeah.
Yeah.
They inspire you.
There'd probably be another
yeah.
15, but off the top of my head, they're the ones that come to mind.
Yeah,
definitely.
They inspire you, the people who have impacted your life.
Big time. I mean, I watched Bruce Lee when I was younger, and that was it. And then, I watched Revenge of the Ninja back in the early 80s, and was way too young to see it because it was a rated R movie, but saw it, and that was the end of it. Off in the martial arts, full-on ninja boom. And then The Rock, I just find him massively inspirational, and the guy has legitimately got a big heart. I see him on Instagram with the people that are sick, and okay, he's the biggest paid actor in the world. To me, that doesn't mean shit to me. He's got a big heart.
Yeah.
So, and to me, that's great.
Yeah.
Totally.
Yeah, he's a good guy. But they're all legends in
They
their
are,
own right.
they are,
That's for
they
sure.
are.
This one a little bit more controversial.
Ooh.
If you could choose to be immortal, would you? Would you be immortal? Would you take that blue pill, or would you stay immortal as the red pill?
No, I would be.
Yeah. You go immortal?
Yeah, I would.
Yeah.
Yeah.
Why, in your opinion?
Can you imagine?
I mean, I'm with you.
Do you imagine,
you have to sell it to me. I'm very much that.
Do you imagine how many people I could help?
Yeah. Right, we've got a lot of work to do. Let's start with Australia.
Yeah.
New Zealand, 25 years.
I think, watching a couple of these Twilight movies with
If
my
you could
wife
fly
and that,
as well, you'd
Oh, no. Watching some of these Twilight movies with my wife and these
brilliant.
these vampires don't die.
Fair enough.
That would be hard, though. To love someone and you're outliving them, they're gone, and you continue. I mean, that.
There's pros and cons to it, isn't
there?
there
There is pros and cons, but I look at the situation as how many people could I help doing what I'm doing, be fantastic.
Absolutely.
You know, so, and then, you know, you're not going to die, so that'd be fantastic.
Yeah. Literally. I'm with you on that one. I think there's just so much to explore. And there's so much to unpack with that question as well, that it really does elicit and open up a whole
It opens up a huge
network
thing.
of questions.
But it opens up a huge opportunity of stuff to do.
Oh, it's just...
Can you imagine?
I mean, why would you
Can
not
you imagine your
really?
life experiences?
Yeah.
Oh, I might go and live in that country for 10 years or 20 years or that.
You'd just be an absolute encyclopedia of knowledge.
Oh,
As long, you know, assuming you're a good person, like
Yeah.
you are, you know, it's obviously, it's like power is dangerous in the wrong hands, but
Yeah.
it does. It's a very,
that'd be
it's a very
fantastic.
romantic idea, isn't it?
Be fantastic.
My last question, which is a bit more serious in nature, I just want to ask all my guests, which is, can you identify a fear that you've had in your life? It can be big, can be small, can be current, can be past, that you've had, what it was and what you've learned, or if you are continuing to face this, what you're learning from it?
Well, 2012 I had the stroke. That was
All right, we're on low power. Fine.
that was huge for me, and that makes you stop and realise what's important in life.
It's a very sobering experience, I imagine.
Massive, and I'm lucky enough to have fought back, and a lot of people don't even know I've had one. They look at me and tell me like, what? Yeah. So, but that basically has changed me in the way of, you know, people, you know, you got some little problem you're worried about, like, seriously? You got to let that go. There's bigger things to worry about, or, you know, really in the aspects of how important you're worried about that thing. Really, there's other things going on you need to worry about. You know, unfortunately, you see those people that just whinge about something, and they've got something to whinge about. Like, you've got nothing to whinge about, really. Perspective. So I think that's really opened up a lot of things to me. And it just also makes you realise just how vulnerable you are. You know, before I had that, I was unbreakable. You know, you go through life, you think, oh, I'm just, nothing can hurt me, nothing. And then you have this event where I had to literally learn to walk again. And let me tell you, that is not an easy thing to do.
I remember you telling me about the physio, mate.
People take walking for granted.
It's a fucking complex thing.
And
man.
here you are, back set back to when you were 1 year old, trying to walk again. And it is an absolute mind fuck.
Humbling comes to mind.
But it's also a mind fuck when you're going,
I know how this works.
I know how this works, and then all of a sudden you can't do it. It is a fucking mind fuck. So you're like,
It's almost laughable, isn't it? In your head, you're like, how the
yeah,
fuck is
yeah.
this
You're
working?
thinking about it, and coming from my perspective too, with I've done all this study and I've done the nervous system, and then you have a massive appreciation for unfortunately the wrong aspect of shit. This is so complex. I mean, I couldn't even whistle.
Jesus.
You know, I'm lucky.
And you've had a full recovery from.
Oh, pretty much, yeah. I've got something that you wouldn't even know I had. Like I might get a little tremor if I try to hold a nail, but I've got past that. Use a pair of pliers so I don't bust my hand. But just little stuff like that. But that's it.
It's minute.
And then, you know, I suppose probably a little bit of fatigue, but I try and punch past that. Probably not as coordinated as I was, because it affected my cerebellum.
Yeah.
So all that stuff, the balance and stuff, but all that came back, and I'm confident. You know, I wouldn't even get up a ladder.
Like vestibular as well, you find you don't get dizzy and all that.
No. Certain aspects, but not terrible. Not terrible. You know, I get my head in, I'm looking under a bed, trying to clean the kids' toys up or something. Might get dizzy for a split second, but no, nothing like that.
That's
so,
pretty amazing, isn't it?
but it's just amazing just knowing. You take all this stuff for granted, and when it's taken away from you, like I remember going to a neurologist. He goes, I'm just trying to run around the backyard. Why the fuck do you want to run? I go, well, I'm not a runner, never have been. But when someone takes something away from you,
You want to do it.
you want to do it.
Fuck yeah.
And I'm lucky I knew the nervous system so well, what I had to do, because when I went to rehab, they had me pulling TheraBands at the wall, and I said to the physio, I said, what the fuck am I doing this for? I need to be on a balance beam. I need to be bouncing balls and catching balls and doing coordination.
Yeah.
And I said, you need to get me in that pool as quickly as possible so I can do that one leg standing exercise in the water so I know I wouldn't fall over. To get my balance back. Like, and once I started doing, then they're like, shit, Matt knows what he's talking about. Oh, I fucking know what I'm talking about.
Yeah, the thing that surprised me about this when you were telling me is that you were orchestrating your own rehab.
In the
with
end,
telling them how to rehab
well, in
you.
the end,
What the
I
fuck
was.
is all that about?
Well, in the end, I was, because I said
Yeah,
to the girl, and she's a lovely girl she was, and I'm like, for someone that is a physio, and this is no disrespect to the physios, but
for sure.
you're in a neurological rehab section. You should be saying, okay, Matt's had a stroke, it's affected his cerebellum. We need to look at his coordination and his balance. Not doing TheraBand.
No,
I could
fuck all.
give me a 15 kilo dumbbell, I could still curl it.
Yeah.
But it's
Could you talk at this point?
no. Well, I could, but not really good. Now the cerebellum, it affected my
That must have been very...
coordination of the muscles of my vocal cords. So yeah, I had to have speech therapy and everything.
That must have been fucking scary.
The whole
man.
thing was fucking scary, man.
That would have been like, mate, that's like you get a lottery ticket. Like you just, man, you must have such an appreciation for life because when it's all taken away, and you're in your head and you're thinking, fuck, then it comes back and you're like, oh.
Mate, it was fucking crazy. I was 38 years old. I knew what was happening when I had it too, and I'm thinking, hang on, what the fuck? I'm 38. I'm having a stroke here.
Yeah.
You know, but
What caused it in the end?
I had a hole in the heart. I had what they call a
That's
paint
right,
foramen
you did,
valley.
you
And
told me
anyway,
about it. They put the
Dr.
umbrella
Ross
in it,
Sharp, he plugged it up and away I went. But look, just appreciation of people take things for granted. You got to enjoy what you're doing. You got to enjoy it because someone takes it away from you.
And it's just that quick.
Split second.
That quick.
Absolute split second. I had no warning. No warning.
But you
Cholesterol,
knew, so you put
cholesterol was
yourself away.
normal. Blood pressure was normal. You know, I go to the hospital at Pindara. They're like, "What's wrong with this bloke? Why is he here?" You know, and I knew what was going on. And you know, unfortunately, there was a bit of fucking around in the hospital there, and I honestly thought I'm fucked. You know, they didn't even have an MRI in Pindara at the time, and I had to go down to John Flynn. I'm sitting on the gurney there. Oh, get him in this afternoon. I thought, fuck, I'm dead. I actually had myself dead. So I'm fucked. You know, so yeah, just amazing. But I was determined to get back.
That's ultimately
And that was
what
the
it
thing,
is.
you know, I'd be in the hospital there and the physio, like, hey, not calling out the daily talk. Said, when are you going to get me on one of those fucking walkers? Oh. So I just push him.
I remember you were telling me.
And then he got me on the standing there, walking down the hallway, and I go, fuck this thing, I want to get one of those little wheelie walkers, and we're doing that. And then I said, no, piss that off, just give me a shoulder, we're walking up the hallway. So I just, I'm in a ward with all these 70, 80 years old, and I'm the youngest guy in there, I'm 38, and I'm like, oh, fucking get me out of here. You know, so...
Fucking motivating,
yeah, no, it's, you've just got to, you can't give up, you got to keep going, mate. Yeah, definitely.
Yeah, that is super inspiring. I remember you telling me some of those chapters. Yeah, as I said before, humbling, sobering, and
I try to forget about it, but
awakening.
I don't mind sharing some of the experiences, and I could go on and on. But
I think though that's good though. To have that is, I wouldn't wish it on anyone, but it's invaluable because you've got the power of empathy to be able to help people rehabilitate. You can really connect with someone and go, hey, look, I have been through this.
Oh, totally.
And you can then go, well, I know what you're going through.
Totally.
From not even the psychological, but the physiological, but then that is just a constantly daily dose of reality just to make sure that you are always never taking shit for granted again.
No,
because
totally.
when you go through something like that, it changes you, man.
Oh, fully.
It changes you.
Absolutely.
Mate, I appreciate it. It's
Been
been
a
a
pleasure.
cracker. Thank
Awesome.
you for joining
Thank
me.
you.
Thank you for sharing some of your wisdom.
Happy to be here.
Mate, pleasure. And for people watching as well, I hope you've enjoyed this, taken some golden nuggets away. And as ever, Matt, for people who want to connect with you, and I will put all these links in the show notes and the description.
At
below.
Hope Island Chiropractic Centre at Hope Island there.
Yep.
If you need to see me, come and...
Yeah. You got any, I know you're not massive on social, but social handles, any websites?
Website, www.hopeislandchiropractic.com.au, on Instagram, Hope Island Chiropractic.
Done.
Done.
Easy. That's all you need, guys. And I'll put these links for if you're listening and watching in the show notes. So I can concur, Matt is the man. You need to go see this fella. If there's something not quite right, reach out. You'll be well and truly looked after.
I'll be happy to help, and if I can't help you, I'll find someone that can.
There you go.
Yeah, totally.
From the man himself. Guys, I will ask one last thing. As ever, if you like the episode, make sure to share it with someone who you feel that would get a lot of value out of this. Like, comment if you've got anything positive, or if you want to see anything specifically, or if you've got a question for myself or Matt, let us know. We will get back to you. And of course, make sure to leave a rating and a review. It's a small task. Thank you for those who've already done it. It's a little bit of your time, but it helps the channel grow, and ultimately it helps fulfill our mission of helping more and more people. So until next time, guys, as ever, stay fearless.
Quick message for those of you who are confused, frustrated, and sick and tired of not seeing the results that you want or deserve. Make sure that you click the Apply for Coaching button in the description below and line up a completely free consultation with myself, where we can discover if it's a good fit as client and coach and take your health and physique to the next level once and for all.